This video will teach you how to care for your child after they have their tonsils out, which is called tonsillectomy surgery. This video is brought to you by the Otolaryngology Department at Seattle Children's Hospital, where we deal with conditions of the ear, nose, and throat, or ENT. Tonsils and adenoids normally help to keep germs out of the throat. Tonsils are in the back of the throat. We may remove tonsils during surgery for snoring, sleep apnea, and frequent infections. After surgery, scabs will form over the surgery sites as they heal. The scabs fall off in about a week, and children usually swallow them. This is part of the normal healing process. Until that happens, keep your child's throat and the scabs moist. You can help your child with this in two ways. Offer them lots of liquids and give them pain medicines to keep their throats comfortable until healed. Your child may have had their adenoids removed at the same time as their tonsils. The adenoids are located in the back of the nose and close to the ears. Your child may snore during this time, but it should improve as the swelling goes down. Or your child may have a stuffy nose, also called nasal congestion, or complain of ear pain after removing their tonsils due to swelling from the surgery. This will get better in about 7 to 10 days after surgery. Pain is common after we remove the tonsils and adenoids. After surgery, we usually send your child home with 2 to 3 medicines for pain relief. These medicines include acetaminophen, also known as Tylenol, ibuprofen, also known as Advil or Motrin, and oxycodone, an opioid prescription pain medicine. Sometimes, because of your child's age or medical condition, they may not be able to take one of these medicines. Use the prescribed medicines as directed. Tylenol is usually okay to give without food, but give ibuprofen and oxycodone with a small amount of food or milk. To help with discomfort, apply an ice pack to the outside of your child's throat and have them drink warm or cool drinks. Straws are okay, but have your child use caution so they don't hit the back of their throat. The pain medicines may not remove all the pain, but your child should be able to drink and do light activities at home. If the medicine prescribed does not control your child's pain, call the clinic so we can help. Many families are concerned about knowing when to give medicines, especially oxycodone. Here are some common scales we use at Seattle Children's to assess pain. The age ranges listed are guides for each tool. Some children find that one tool makes more sense than another. Use the tool that is most appropriate for your child and their developmental level, rather than by age. In general, if your child's pain is rated a 6 or higher using one of these tools, then give oxycodone. Pain levels tend to be higher in the first 4 to 7 days after surgery and when the scabs fall off during the next week. We use different pain rating scales for infants, toddlers, and children who cannot speak. Look at your child's body movements and vital signs. Compare them to this list of pain signs to see if your child is in pain. You can ask your child's nurse for more information about these scales. It is likely your child will take acetaminophen and ibuprofen every 6 hours for the first 4 to 7 days after tonsillectomy surgery. Some children might need pain medicine for a longer time, up to 2 weeks. The reason we prescribe acetaminophen and ibuprofen is because each works a bit differently to control pain. We recommend alternating these medicines every 3 hours so your child has longer pain coverage throughout the day. Using the pain medicine log will help keep track of when each medicine is due. For example, if you give Tylenol in the morning at 7 a.m., wait 3 hours and give ibuprofen at 10 a.m. Wait 3 more hours and give Tylenol again at 1 p.m., and so on. To prevent more pain in the morning, you may need to give pain medicines during the night. Many times, if your child is resting comfortably at nighttime, you do not have to wake them up to give pain medicines. Take cues from your child about what will work best. If they are already up during the night to get a drink of water or use the toilet, that may be a nice time to also give them pain medicine. We may prescribe a stronger medicine called oxycodone for breakthrough pain. Breakthrough pain means that your child isn't able to drink enough fluids even with acetaminophen and ibuprofen. Only give oxycodone if needed. Your child may or may not need this medicine. For example, if your child is due for Tylenol, but their pain seems severe, it is okay to give Tylenol and oxycodone. Oxycodone can be repeated every 4 hours as needed. Let's look at an example. The time is 1 p.m. Your child had Motrin at 12 noon, and Tylenol isn't due until 3 p.m. Your child says their pain is an 8 on the FACES scale. You would give oxycodone at 1 to treat the severe pain and still give the Tylenol when it is due at 3. The medicines all work differently, so it is important to stay on schedule with acetaminophen and ibuprofen, even if you give them oxycodone. Remember, only give oxycodone if needed, and not sooner than every 4 hours. The pharmacy will provide you with information on how to safely dispose of oxycodone when your child no longer needs it. It is safest not to keep leftover opioids in the house, especially unlocked or in easy-to-reach places. After surgery, your child may eat whatever is comfortable for them. However, cool, soft, bland foods and drinks may feel better to swallow at first. Start with foods such as ice cream, popsicles, yogurt/smoothies, fruit, pudding, soups, noodles, rice, beans, or porridge. If your child isn't hungry in the first couple of days after surgery, that's okay. As they feel better, their appetite will return. Drinking liquids is most important, and we'll talk about the after-surgery drink chart you will be filling out at home. Ask your doctor if they recommend avoiding hard and crunchy foods during the first 2 weeks. Hydration means your body is getting all the liquid it needs. Drinking liquids after surgery is very important. We will give you an after-surgery drink chart to track your child's drinking. Your nurse will need to tell you how many cups of liquid your child should drink based on their weight. Encourage your child to drink whatever is comfortable for them. For some, that may mean things that are cold. For others, it may mean warm. Some ideas include water, juice, milk, tea, or rice porridge. It is safe to drink with a straw after surgery. If your child is not meeting their hydration goals, please contact the Otolaryngology Clinic. It is important that your child gets rest after their tonsillectomy. Your child should stay home from school or daycare for at least 1 week after surgery. Your child is ready to return to school as long as they don't need pain medicine during the school day. During these first 2 weeks, your child should avoid exercise and rough play, such as running, jumping, playing on playground equipment, and riding bikes. Encourage light activities, such as watching movies, coloring, playing with toys, and reading books. If you need a school note for PE or physical education class, please let your nurse know on the surgery day. Fevers are common after tonsillectomy surgery. This is part of your child's normal immune response. If your child feels warm, take their temperature. Temperatures under 102 degrees Fahrenheit are usually okay. If your child has a fever of 102 degrees or higher for more than 6 hours after taking acetaminophen or ibuprofen, please call the Otolaryngology Clinic. If your child has other concerning symptoms, such as a bad cough, or they are working harder to breathe, take them to your regular doctor. Bleeding from the surgery sites is rare but can occur up to 2 weeks after surgery. Risks of bleeding are more than common just after the surgery, and when the scab falls off during the next week. Watery drainage from the mouth or nose is common on the day of surgery. However, if you see bright red bleeding from the mouth or nose, or your child is vomiting blood, please bring your child to the nearest emergency room. You should call the doctor or clinic if your child is not meeting their hydration goals on their hydration log. If their pain is not controlled with the prescribed medicines, if your child has ongoing nausea or vomiting, if they are unable to urinate or pee for 12 hours, if they have fevers over 102 degrees Fahrenheit that do not go down after taking acetaminophen or ibuprofen. You should take your child to the emergency room if they have any bright red bleeding from the mouth or nose, or any blood in their vomit. Here's a quick review of things to know. Alternate acetaminophen and ibuprofen every 3 hours for the first 4 to 7 days after surgery. Use oxycodone for severe pain. Your child may eat and drink whatever feels comfortable to them. Record liquid intake on the after-surgery drink chart. Keep your child home from school or daycare for at least 1 week after surgery. Encourage rest and light activities for 2 weeks after surgery. Fevers up to 102 degrees Fahrenheit can be normal after surgery. Watery drainage is normal after surgery. Bleeding is not. For any bleeding, take your child to the nearest emergency room. If you have any questions or concerns, please call the Otolaryngology Clinic at 206-987-2105, extension 4, Monday to Friday, 8 a.m. to 4:30 p.m. Or you can send us a non-urgent message through your MyChart account. During nights, weekends, and holidays, for urgent matters, please call 206-987-2000 and ask the operator to page the otolaryngology or ENT doctor on call.